think one of the major unmet need or unanswered questions for CAR T in multiple myeloma is that the current approved therapy is given without any maintenance. And so will the advances in this genetically edited cellular therapy approach by itself as a one-time treatment be potentially curative for our patients? And so it is not just that they can keep the myeloma in remission, but the recovery and quality of life post-treatment without the need for any maintenance can be very meaningful for our patients. So can our technology get there? And I think some of these, longer-term follow-up, even with cilta-cel, and then certainly next-generation CAR T, certainly makes me very hopeful. But along the way, there are, of course, also combination trials where we're trying to understand, okay, well, maybe right now with the limitation of our genetic editing, we can't quite get there. So are there safe ways to combine CAR T with other immunomodulatory type of treatment so that we can have a safety profile or treatment burden that is acceptable to the patient and still offer them meaningful control of their disease. So I think that is really the next goal that we all want to strive towards.